For my literature review, I decided to focus on nursing audits and the effect they have on patient safety. Safety in nursing is obviously the biggest concern that many healthcare... What am I trying to say? The subject of my literature review was patient safety audits and how they affect the outcome of patient safety, either negatively or positively, or whether they affect it at all. I think this is a really important subject, not only because I deal with it every day. I work at Nebraska Medicine, and I see this every night, especially with my nightlies, how they go about conducting these audits, which I will talk about a little bit later. But also, I think safety is a nursing concern that can't be overlooked. It is obviously probably the biggest platform, probably the biggest subject that there is in nursing. I mean, patient safety is really the biggest thing in it at all. But I was, interestingly enough, the research I did for this paper, I found a lot of kind of interrelated information that I wasn't expecting, as well as some lack of information based on the kind of audits that I was researching. But the reason, like I said, the reason that I chose a subject that is something we all will go about with in our career as nurses, and I see it every night at work. For instance, one of the big auditings that I focus on is medication safety, and the audits that are performed, I interviewed Kim Ostermeyer, who is a registered nurse and also one of our lead nurses at night on our floor. We're a telemetry floor, and we get a whole array of patients. We get heart patients, as telemetry would kind of allude to, but also, we get drug overdoses, alcohol withdrawals, gastrointestinal patients. We kind of get the whole share of it. So you really do get to see how all these audits work and the kind of effect they have on patient safety. When I was talking to Kim about all this, she really emphasized the importance of some of the audits that she, as a lead nurse, conducts, but also as some of the other nurses conduct as it pertains to their nurse residency. This is kind of where my research got interesting, because I was able to find some information about auditing as it pertains to medication administration, but not so much on other factors of audits she does, such as fall safety risks, heparin audits, restraints, crash cart audits, so on and so forth. So I do think my research was eye-opening, and because it kind of highlighted where there were gaps in research, as well as really showed where there was some good stuff being done, I guess you could say. One of the research that one article that I found was one that was great about how a feedback loop with nursing audits, how that is effective. It was an article the article from the 2015 implementation of an audit with feedback knowledge, the translation intervention for medication error reporting. It was a good protocol for it. They kind of used the acronym SMART, the Safe Medication Audit Reporting Translation, to really see what kind of, if audits are being done, what kind of intervention was the best way to go about doing it. And to be honest, the conclusion of the research was a little muddy, because there isn't a really straightforward answer to go about kind of analyzing it in the long run. But I think what is great about it is that it's at least opening the door to everything. It's bringing it out there. It's showing where there are issues that it isn't being discussed or isn't being researched, because it was hard to find a lot of good resources about auditing. even medication auditing, but even further auditing beyond medication safety. So I think that's a really good place where my interview with Kim Ostermeyer comes out. And she just had really great insight into how her audits are done, and they're very often done either physically or through the computer. She goes around and checks in the medication drawers and all that, medication drawers, and she does a narcotic count with the day nurse, and she really focuses on just, not only patient safety, but also making sure the staff is safe from documentation errors or miscommunication or issues that revolve around that. So I was surprised how little I was able to find on it, and I think that kind of, in turn, I was hoping to learn more. I was hoping to see how it worked on a broad scale. I was able to find research that had to do with other countries and but I really wanted to focus on how audits were performed and how audits were used here in the United States. But the stuff I learned a lot from Kim Ostermeyer, and I think that was the biggest kind of resource I had, and I think it was the most relevant because it is firsthand knowledge. It is something that she does it, 4 to 5 nights a week. She is the firsthand person for all this. So I was surprised on what I learned, and kind of not surprised in the same sense, but I really appreciate kind of what I learned from her, and I think that it's a great subject to really engage yourself in, and I hope there's a lot more information to be said about it in the future.